How do you stop taking Perphenazine, Trilafon safely? If you are considering stopping Perphenazine, also known as Trilafon, it is important to understand the best way to do this safely. Perphenazine is a typical antipsychotic medication often prescribed for managing symptoms of schizophrenia. It works by blocking certain chemicals in the brain, particularly dopamine, which helps control symptoms like hallucinations and delusions. However, stopping this medication requires careful planning and medical guidance. First and foremost, consult your healthcare provider before making any changes to your medication. Your doctor will evaluate your current condition and determine the safest approach for discontinuation. This step is essential to ensure that you do not experience a worsening of your symptoms. One of the safest methods to stop taking Perphenazine is through gradual dosage reduction. This means that instead of stopping suddenly, your doctor will likely recommend lowering your dose slowly over time. This gradual tapering helps reduce the risk of withdrawal symptoms, which can include nausea, vomiting, and restlessness. During this tapering process, it is vital to monitor your symptoms closely. Your healthcare provider will check in with you regularly to ensure that you are not experiencing any significant changes or worsening of your schizophrenia symptoms. This monitoring is key to a safe transition off the medication. Having a support system in place can also be beneficial. Friends or family members can provide emotional support and help keep an eye on any changes in your behavior or mood. Their presence can make the process feel less daunting. In some cases, your healthcare provider may suggest alternative treatments or medications to help manage your symptoms during this transition. This can be especially helpful if you find that your symptoms are returning or worsening as you reduce your Perphenazine dosage. Regular follow-up appointments with your healthcare provider are crucial throughout this process. These visits allow for ongoing assessment of your mental health and ensure that the discontinuation of Perphenazine is being handled safely and effectively. It is important to be aware of the potential risks involved in stopping Perphenazine. Abruptly discontinuing the medication can lead to withdrawal symptoms and an increased risk of relapse. This is why a gradual tapering approach is always recommended under medical supervision. Lastly, some side effects, such as tardive dyskinesia, may persist even after stopping Perphenazine. If you experience any ongoing side effects, be sure to discuss these with your healthcare provider. In summary, stopping Perphenazine safely involves consulting with your healthcare provider, gradually reducing the dosage, monitoring symptoms, and having a support system in place. This careful approach helps minimize risks and ensures a smoother transition for individuals managing schizophrenia.